Have you ever wondered how medical professionals understand the complex human body? A surgeon navigating the labyrinth of our internal organs, a nurse pinpointing the exact location of an injection, or a physiotherapist explaining the movement of a specific muscle. They all rely on a universal language known as medical terminology. Medical terminology is a fascinating world of words and meanings, and it's a vital tool in the healthcare industry. It's like a secret code that allows professionals to express precise information about the human body and its conditions. This language, with roots in Latin and Greek, is used globally, fostering seamless communication among healthcare providers, no matter where they are in the world. The human body is a marvel of nature, intricate and complex. It's a vast universe of organs, tissues, cells, and processes, each with its unique name. These names or terminologies are not mere labels. They carry within them a wealth of information, telling us about the location of an organ, its structure, its function, and even its disorders. Take, for instance, the term cardiology. Cardio is derived from the Greek word for heart, and logi means study. So, cardiology is the study of the heart. Simple, isn't it? Now imagine a world where every organ, every ailment, every procedure has such a descriptive name, and you'll begin to grasp the scope and necessity of medical terminology. Medical terminologies are not just about organs, they also encompass prefixes and suffixes used to identify body parts and directional terms. These additions to the root words provide further clarity, making communication even more specific and accurate. So, whether it's anatomical landmarks, physiological processes, or directional references, medical terminologies play a vital role in the healthcare domain. They are the foundation of medical knowledge and practice, ensuring clear and precise communication, and thereby effective patient care. Let's delve deeper into the world of medical terminologies and their meanings. Stay tuned as we unravel the intricacies of this fascinating language, one term at a time. Understanding anatomy and physiology is like learning a new language. A language that serves as the foundation for comprehending the complexity of the human body. Let's delve right into some key terms that will help us navigate through this intricate world. First off, anatomy. This term originates from a Greek word which means to cut open, and it refers to the study of the internal and external structures of the body. It's all about understanding what the body is made up of and where each part is located. Physiology, on the other hand, is the study of how these structures function. It answers questions such as, how do our lungs oxygenate our blood, or how does the brain process information? It's like the software running the hardware that is our body. Now let's talk about some common terms. Anterior and posterior are two of them. Anterior is derived from Latin, meaning before or in front of. In the medical world, we use it to refer to the front side of the body. So if we say the heart is anterior to the spine, it means the heart is in front of the spine. Posterior, quite contrastingly, refers to the back side of the body. It's the opposite of anterior. If we say the spine is posterior to the heart, it means the spine is behind the heart. These terms might seem confusing at first, but they're actually quite intuitive once you get the hang of them. Another pair of terms you'll often come across are superior and inferior, denoting above and below, respectively. For instance, the nose is superior to the mouth and the mouth is inferior to the nose. With these terms, we can start to paint a clearer picture of the human body. We're only scratching the surface here, and there's a lot more to learn. Stick around as we dive deeper into the fascinating world of medical terminology in the coming scenes. Now that we have the basics down, let's move to the prefixes used in medical terminology. These are the little linguistic nuggets that are tacked onto the beginning of words to give them a specific meaning. They're like the appetizers of a meal, setting the stage for what's to come. Let's start with hemi, a prefix of Greek origin. Hemi means half, and when it's attached to a word, it modifies the meaning to indicate a part or a section. For instance, in the term hemisphere, hemi tells us we are talking about half of a sphere. Next in line is hyper, another prefix that also hails from Greek. This one means excessive or above normal. When we say hypertension, for example, we're referring to a condition where the blood pressure is consistently too high. Let's not forget hypo, the antithesis of hyper. Originating from the same Greek root, hypo means under or below normal. So hypotension describes a condition where the blood pressure is too low. Then we have anti, another Greek origin prefix meaning against. When we talk about antibiotics, we're referring to drugs that work against bacteria and other microorganisms. Lastly, let's look at peri, meaning around or near. In terms like pericardium, it refers to the sac-like structure that surrounds the heart. There are countless more medical prefixes out there, each with its unique meaning and application. These prefixes, as small as they may seem, play an integral role in medical terminology. They allow us to decipher and understand complex medical terms, making them less intimidating and more accessible. Remember, medical prefixes are more than just linguistic embellishments. They provide essential context and nuance to medical terms, helping us to communicate more effectively in the world of health and medicine. These prefixes add more context and specificity to our understanding. And with that, we've wrapped up our dive into medical prefixes. Stay tuned as we venture into the world of medical suffixes next. Just as prefixes add to our understanding, suffixes play an equally important role. Yes, indeed, the world of medical terminology is like a jigsaw puzzle where each piece, whether it's a prefix, root word, or suffix, holds significance. Today, we're going to delve into the universe of medical suffixes and how they help us decode the mysteries of medicine. Think of suffixes as the tail end of a word. They're tacked onto the end of root words and can completely transform their meaning. Let's take a few examples to understand this better. Consider the suffix itis. It's derived from Greek and means inflammation. So when you hear words like bronchitis or arthritis, you know that there's some sort of inflammation involved. Bronchitis involves inflammation of the bronchi in your lungs, while arthritis refers to inflammation in the joints. Another common suffix is ectomy, which means removal. This one's a biggie in the surgical world. For instance, when you hear appendectomy, it signifies the removal of the appendix. Similarly, a mastectomy involves the removal of a breast, often as a treatment for breast cancer. There's also osis, which denotes a condition or disorder. For example, osteoporosis refers to a condition where bones become weak and brittle. And halitosis? Well, that's just a fancy term for bad breath. There are countless medical suffixes, each with its own specific meaning and usage. They're like clues leading us to understand the nature of different medical conditions, procedures, and therapies. And while it may seem like a lot to remember, with practice, it becomes second nature. So the next time you come across a complex medical term, don't be intimidated. Break it down, look for the prefix, the root, and the suffix. You'll be surprised at how much you can decipher. Suffixes help us understand the nature of medical conditions better. And that, my friends, is the magic of medical suffixes. They not only add meaning to medical terms, but also make the complex world of medicine a little less daunting. Directional terms are the compass of medical terminology. These are the tools that allow us to navigate the human body with precision and clarity. Just as a compass points to north, south, east, and west, directional terms in medical terminology guide us through the complex landscape of the human body. Let's start with superior and inferior. These are terms that help us understand the vertical positioning of body parts. Superior is used to describe something that is positioned above or is higher than another part. For instance, in relation to the nose, the eyes are superior. On the other hand, inferior refers to something that is below or lower than another part. So, in relation to the nose, the mouth is inferior. But the human body is not just a vertical plane. We also need terms to describe front and back. This is where anterior and posterior come in. Anterior refers to the front, or towards the front of the body. For instance, your chest is anterior to your back. Posterior, then, naturally refers to the back or towards the back of the body. So your back is posterior to your chest. And that's just the tip of the iceberg. There are many more directional terms that help us pinpoint exact locations and directions in the human body. But remember, like any language, it takes practice to become fluent. With these directional terms, navigating through the human body becomes easier. Let's take a moment to recap what we've learned. We've navigated through the maze of medical terminologies, understanding their anatomy and physiology. We've learned how prefixes and suffixes shape these terms and guide us to the right body parts. We dive deep into the directional terms, showing us where exactly in the body we are. It's a vast world, rich and complex. But remember, with the strong foundation we've laid today, mastering it becomes a lot more manageable. The world of medical terminology is vast and complex, but with a solid foundation, it becomes a lot more manageable. We've taken a fascinating journey today into the world of medical terminology. Understanding this language is key to unlocking the mysteries of the human body. The knowledge gained here will serve as a foundational tool in your medical journey. Thank you for joining us. Don't forget to subscribe for more enlightening content on medical terminologies and beyond.